Parents often go to the pediatrician because their child has yet another cold. Winter is the prime time for colds. Young children are more prone to getting viruses and colds because they're encountering these viruses for the first time. This is absolutely normal in the stage in developing of their healthy immune system. Children and infants can suffer from 8 to 12 colds a year. If these colds are lasting from 1 to 2 weeks, and they're getting 8 to 12 a year, you can imagine that they're often sick more often than they're not sick. The symptoms of cold are many. We all recognize most of them. Your child may have congestion, runny nose, sneezing, coughing. They might have a sore throat. They might complain of headache, have a poor appetite. They might have a mild fever. Most of these symptoms last about 1 to 2 weeks. How are they spread? Well, we often think that maybe by going outside and in public places it's spread there, but really it's from your child touching their noses, touching other children, touching toys in waiting rooms, touching toys anywhere really, and then rubbing their eyes and their mouths. It spreads very easily. So as a parent, how do you prevent the spread of colds? Well, one of the biggest things that I always recommend is washing hands. Teach your children how to wash hands for at least 15 to 20 seconds, especially after they cough or sneeze, or if they're in contact with someone else with a cold. Also, make sure your child has received all of the recommended immunizations in your own territory. While it won't prevent the actual cold from occurring, it often presents the complications, such as infections in the ear and breathing problems. Additionally, you can wash the toys that your child might be placing in their mouths, or the toys that they have at home. It might be tempting with all of these symptoms to treat your child with over-the-counter products. However, these should not be used in children less than 6 years of age. The best way to treat colds is plenty of rest. Try to get some fluids in them and nutritious meals when they're ready to eat, not with over-the-counter drugs. The only exceptions are to this is some ibuprofen and Tylenol or acetaminophen. These can help treat fever or quite severe discomfort and should be used according to the package directions. When should you be worried? Well, anything that you think that you're worried about, you can go see your pediatrician for. If your child is having some increased breathing, looks like they're really struggling to get air in, if they're vomiting because of coughing or choking, or has any blue color to their lips or otherwise, then please seek help.